Welcome to The Explainer. Today, we are going to tackle one of the most basic, but also one of the most misunderstood medical measurements out there: blood pressure. We're going to figure out how to get a number that's actually telling you the truth about your health. So, let me just ask you this: is your blood pressure reading lying to you? It sounds a little dramatic, right? But honestly, a simple, rushed measurement can be completely wrong. Super common mistakes, things as simple as the cuff size or how you're sitting, can give you a reading that sends you and your doctor down the wrong path. So let's find out how to get the real story. All right, here's our game plan. First, we'll talk about why just one reading is a bad idea. Then, we'll cover how to get everything prepped before you even start. We'll dive deep into the cuff itself, which is super important. Then, we'll go through the measurement step by step. And finally, we'll look at some of the weird situations that can pop up. Okay, so first things first, the accuracy problem. You have to understand that your blood pressure is not some fixed number. It's changing all the time, minute by minute. It goes up when you're stressed, when you've had coffee, even when you're just talking. So a single casual measurement, it's just a snapshot in time. It might not tell you a thing about your actual baseline health. So what's the solution? Well, it's pretty simple. We are not looking for one single perfect number. The real goal is to find the average of at least two separate measurements taken very carefully with a minute or two of quiet rest in between. That's how you smooth out all those random little spikes and dips and get a number you can actually trust. So if the plan is to average a couple of readings, that means each one of those readings needs to be as close to perfect as possible. And that whole process, it starts way before the cuff even gets inflated. Getting the setup right, creating a calm environment for your body and your mind is absolutely everything. Look, this checklist right here, think of it as non-negotiable. You have to rest for at least 5 minutes, just sitting quietly. Why? It lets your body get back to its resting state. No coffee or smoking for 2 hours beforehand, because those are stimulants that will jack up your pressure. You even have to stop talking during the measurement. Just sit there quietly in a comfy chair with your back supported. It all makes a huge difference. Okay, now we need to talk about what is, without a doubt, the single most critical piece of the puzzle, and it's also where most errors happen. I'm talking about the cuff. If you get the cuff size and its placement wrong, it doesn't matter how perfect the rest of your technique is. The reading will be garbage. And here is the first golden rule for cuff size. See this number? 40%. The width of the inflatable part inside the cuff, the bladder, needs to be about 40% of the distance around your upper arm. It's a very specific ratio, and it's for a very good reason. This slide gives you a perfect analogy for why that matters. If the cuff is too small, it's like trying to squeeze a water balloon with just your fingertips. You have to squeeze way too hard, and that gives you a falsely high blood pressure reading. The length of that bladder also matters. It needs to wrap around at least 80% of your arm to get nice, even pressure for an accurate number. And where you put it is just as crucial. It's got to be on your bare arm, never over your clothes. You want to line up the middle of the cuff right over your brachial artery. That's the one on the inside of your upper arm. The bottom edge should be about an inch above the bend in your elbow, and it should be just loose enough that you can slip one finger underneath. Not two, just one. Okay, the stage is set, we've got the right cuff, and it's in the right spot. Now what? Let's walk through the exact procedure step by step. If you follow these steps, you take all the guesswork out of it and get the most accurate reading you possibly can. So here's the process. First, you estimate the top number. You feel your pulse at your wrist while you inflate the cuff. When the pulse disappears, you look at the number on the dial. Then you pump it up another 30 points. This step is so important, and we'll see why in a minute. Then you place your stethoscope and you let the air out slowly. You listen for that very first thump and the very last one. Write those down, wait a minute or two, and do the whole thing again. Then you average them. You know, that might seem like a lot of steps, but it really boils down to this one simple idea. As you're letting the air out, that very first heartbeat sound you hear, that's your top number, the systolic pressure. And the exact moment that distinct beat vanishes for good, that's your bottom number, the diastolic. It's that simple. But what happens when things just don't go by the book? You can have perfect technique, and sometimes you still run into some weird situations. Biology is complicated, right? So let's talk about a few common curveballs you need to watch out for. Hey, remember that very first step I said was so important, estimating the pressure? Well, here's why. There's this little villain called an auscultatory gap. It's basically a patch of silence that can happen right after the first few beats. If you didn't inflate the cuff high enough, you might start listening for the sound inside that silent gap, completely miss the real first sound, and write down a systolic number that's way too low. Estimating first lets you pump the cuff high enough to blow right past that trap. And here are a few other oddballs. Sometimes the sound just never goes away, it goes all the way down to 0. If that happens, you just use the point where the sound gets really muffled. In some older folks, super rigid arteries can give a fake high reading called pseudohypertension. And if you're dealing with a very large arm, where even a large cuff won't work, you can just use the pulse method instead of a stethoscope to get a more reliable number. And a really thorough evaluation goes even deeper than that. On a first visit, a doctor should check the pressure in both of your arms. If there's a big difference, that's important information. It's also a good idea to check it in different positions, sitting, lying down, standing up, to see if there are any major drops. These little details help build the most complete and accurate picture of your health. So after all that, what is the one single most important thing to take away from this? It's really simple. Don't put too much trust in any one blood pressure reading. It's a snapshot. It's not the whole movie. The real story, the truth, is found in the average of at least 2 measurements taken with care, with patience, and with the right technique. So now you have the tools. You know the secrets to getting a truly accurate reading. You're no longer just someone this happens to. You can be an active, informed participant in your own health. The next time a cuff goes on your arm, you'll know exactly what's happening and why every little step matters. So the only question left is,